Charlie Wang, who's been a resident and now a fellow here. He has a MD and a PhD, and his talk will be on fingerprinting approach for improved hyperpolarized C-13 acquisition resolution. Um, spatial resolution, sorry. Um, and yeah, so it's really exciting. We've been doing some new acquisitions here for this. And Dr. Wang, you want to?
Hello, everybody.
Yeah,
Um, Thank you for the introduction, Dan.
yeah,
We'll just get right into it. As everyone knows, the number of sites and applications for hyperpolarized carbon is just growing rapidly, and it's very exciting. All of these new fields, and my other I have both the background in engineering, but I'm currently a neuroradiologist, almost at the end of my training. So it's very exciting to see all of these clinical applications taking off. And in particular, in the brain, I'm just showing an example figure from uh, Dr. Autry in our group, showing the possible applications in evaluating glioma. And this is already fairly old at this point, but we showed some very exciting results. And then more recently, this was very recent after combining some of the old methods with multivariable resolution approaches, denoising methods. We have some data sets now that Dr. Altry here showed that for serial exams in the same patient, we have very nice uh, intra-patient reliability even across these uh, very different time points. And with pathology, we have consistent KPL potential abnormalities correlating with the site of prior disease. So very exciting things coming up that I think we'll see much more of in the coming years. But just as a baseline for normal volunteers, normal brain, I feel like if I were to show these kind of results for our basic hyperpolarized carbon-13 experiments to my colleagues in the neuroradiology reading room, I think first they will panic because anytime you show a neuroradiologist or radiologist in general a color map picture of something they're not familiar with, they get a baseline uh, adrenaline surge of panic and disorientation. But beyond that, I think even if we were to just talk about the correlation between our reference proton imaging and what we're seeing in these hyperpolarized maps, I think we do have to go a good amount of effort to describing what are we seeing, what are the limits of what we're seeing, and these are the things that will basically drive whether we can convince radiologists that these should be part of a clinical exam, that they have um, a patient by patient use case and uh, uh, clinical use. And even for like something we talk about pyruvate to lactate metabolism. This image on the right, this is just lactate to pyruvate ratio, which is a good enough proxy of it, but this amount of signal variability with the gray and white matter, even as advanced as the methods are these days, I think this still has a ways to go before the clinical neuroradiologists will be excited about trying this on all of their patients. So uh, as a as a personal goal, this resolution and signal reliability is something I want to I have been working on for some time now. And our goal here is to just improve our sequence design. There are a lot of other sides of how we can improve reliability, including polarizing, the path and minimizing the time to injection and all of the post-processing methods. But my focus here is on the pulse sequence design itself. And we just want to maximize this measurement efficiency for underlying metabolism. Um, and then my approach to this, I am a big fan of the uh, paradigm of MR fingerprinting for pulse sequence design. And in these particular cases, I like the balanced steady state reprocession approaches for the high SNR efficiency, maximize overall SNR, and leveraging that to drive the signal uniqueness to the underlying tissue property of interest, in this case, pyruvate to lactate forward rate constant. And then at the same time, because we're using a less validated, less potentially more confounded whole sequence approach, we do have to worry about all of these other potential variables in the signal model, specifically T1s, T2s of our metabolized, the B0 and the B1, and other potential things that I won't get into so much detail now. But for now, I'll just start with a basic fingerprinting background. For those who are familiar with the proton fingerprinting work, this slide has been around for probably 10, 15 years now, but the basic idea is that we want to have a pulse sequence with a unique and incoherent signal model relative to the parameters of interest. And we combine this with a pattern recognition approach, usually from a block simulation. And we use a combination of these two to derive the underlying tissue information in proton world. They were initially using this to quantify T1, T2, B0 field, proton density, and they showed very nice results, being able to use what appeared to be pseudo-random flip angles and TRs to get very nice signal evolution differences between gray matter, white matter, fat, CSF, and off resonances, and use that to do their parameter estimation. And essentially, it is a very, very powerful framework for arbitrary pulse sequence design and parameter estimation. I think the pseudo-randomness has been kind of this distracting branding effect that a lot of people have talked about, but the true power of it really is this arbitrary pulse sequence design, that we can do anything, including pseudo-random methods, or any other method that we feel that will best characterize our underlying metabolism. So to this effect, in applying it to hyperpolarized carbon-13 approaches, this started, initially we used the MS3D SSFP method developed by Dr. Tang previously, where this was a BSSFP approach for lactate sampling, but maintained pyruvate sampling using a GRE approach. And this was a nice starting point. But from there, we adopted a complete SSFP-based approach for sampling both pyruvate and lactate metabolites using a variable flip angle approach, using interleaved blocked acquisitions, separately sampling using selective RF excitation, both pyruvate and lactate. And we have some delays. But the important part here is that we have this meshed filter based pyruvate flip angle design. So using the flexibility of the fingerprinting approach for parameter estimation, we can now do kind of any arbitrary pulse sequence design. So in this work, we focus mostly on this sigmoid flip angle envelope for pyruvate sampling while maintaining a relatively uniform sampling method for lactate. That's this pulse sequence diagram on the top right here with the flip angle. In blue is pyruvate, where you can see at the first half of the acquisition, it maintains this very, very low flip angle design, somewhere around 8 degrees. Then around 15 seconds or so after injection, it ramps up and it goes all the way up to about 80 degrees flip angle, whereas lactate is maintained at about a 50-degree flip angle. So, and the idea of this is to preserve our pyruvate signal beyond the initial bolus, beyond the arterial input component of our underlying physiology, allow it time to get transferred into lactate, and then do more of our pyruvate sampling afterwards while sampling lactate throughout. And then to do parameter estimation, we go back to the fingerprinting basic approach of generating a dictionary across KPL from a block McConnell simulator and doing template matching. And then just to look at this dictionary, on this top here, this is kind of a couple excerpt signal evolutions from the dictionary. On the left are the signal that we take from the pyruvate acquisitions, and on the right is the signal from the lactate acquisitions. So you can see kind of the effect on the left here on pyruvate signal, where the initial low flip angles kind of have a low muted measured signal that ramps up after the first 15 seconds and then goes up to a relative peak. But all of this is modulated by our T1 of pyruvate. So even though we go from 8 degrees to 80 degrees flip angle, we only see this kind of maybe 2 to 4-fold increase in relative pyruvate magnetization. On the other hand, because we're doing this more uniform lactate sampling, this is really just driven by the KPL forward exchange rate from pyruvate to lactate metabolism. So even though we have a relatively constant flip angle, we still see kind of similar to our traditional GRE-based methods, kind of signal evolution for lactate. And just for comparison, this is using the same simulation parameters with a dictionary for the previous MS3D SSFP method with a GRE measurement of pyruvate and BSSFP measurement for lactate dictionary would look like. And then just for comparison's sake, you can just immediately tell the pyruvate signal is probably an order of magnitude lower and not as sustained for as nearly as many acquisition data points compared to our SSFP-based acquisition. And part of this is not exactly a fair comparison because the acquisition window for each one of these EPI or GRE-based acquisitions is much longer than what we would get from a BSSFP-based. We only have a 15 millisecond TR here, so it's not a complete one-to-one comparison, but it does get you the general sense of the absolute signal magnitude difference that we are seeing by going to a GRE to a BSSFP-based acquisition. And not only is the pyruvate signal higher, the lactate signal in the latter half of the acquisition is increased because we're preserving the pyruvate signal as well. So because we have a preserved pyruvate magnetization, more magnetization is allowed to transfer into lactate. And when we were designing this sequence, we had some preliminary experiments looking at all sorts of different pulse sequence designs. And this was a very basic Monte Carlo experiment to explore the different, using our now arbitrary, unlimited pulse sequence design space. What are the possible different pulse sequence designs we should possibly consider? And amongst them, we did various kinds of constant flip angle approaches, linear ramping approaches, and this sigmoid-based approach just slightly eked out these linear ramping approaches from a precision of KPL estimation through these preliminary Monte Carlo simulations. So that's why our later sequence designs focused on a sigmoid approach. And then fleshing this out more, this was a lot of work done by Anna Bennett, who did very thorough Monte Carlo simulations examining exactly these 3 different approaches. So hybrid GRE is that initial 3D SSFP approach by Dr. Tang with the combined GRE pyruvate sampling and BSSFP lactate sampling versus a constant flip angle fingerprinting approach versus the sigmoid flip angle based approach. And as we can see here, blue for the vast majority of different like true KPL, um, underlying KPLs, blue is the narrowest standard deviation of Monte Carlo experiments for a particular noise level. But we also see that that's not necessarily true at all KPLs. Like at the very, very low KPL regime, constant flip angle and sigmoid uh, flip angle perform similar, and maybe the constant flip angle outperforms it slightly. But for the rest of the KPL space, particularly in the high ones where we expect pathology to reside, the sigmoid-based approach was the um, most precise. And if we look at the actual distribution of these results, even though this is a dictionary-based approach where we have a discretized kind of like multiple choice kind of result of parameter estimation, they still look very normally distributed at different noise levels. So here in the gray is a higher simulated level of noise, and in the blue, dark blue is the lower simulated noise. And on the right here, that is, again, that previous combined hybrid GRE and BSSFP-based approach with the same two levels of noise as the sigmoid one here, and we just see for the same given amount of noise, parameter estimation using a dictionary-based approach, we have a much larger standard deviation of KPL matching. So this kind of this is what the previous figure kind of was summarizing in a much more concise format. And the precision of matching, as I mentioned before, is not the only factor. Now that we're going into a much more involved pulse sequence method, we do now have to worry about how do our other sequence or tissue parameters potentially influence the parameter estimation of KPL. So here I'm showing if, and because we're not actually estimating these in the dictionary approach, right now it's just a single dimension of KPL and assuming a T1 of pyruvate, a T1 of lactate, and so on and so forth. So if there is a mismatch between our assumed parameter versus our in vivo, what is the expected error in KPL match? So these figures are characterizing that. So for instance, in the top left, we show if we have a true in vivo T1 of pyruvate of 40 versus the middle number here, which is what the dictionary assumed of a T1 of 30, how much error should we expect in our KPL match? So if the T1 of pyruvate is as low as 20, then we would expect an overestimation of matched KPL by about 0.003 from and these are all using a 0.02 as the underlying true KPL value. So there is clearly an error dependent on each one of these parameters. And in red is that hybrid approach I've been comparing to. And in green is the constant flip angle approach. And in blue is the sigmoid-based approach. So for T1 of pyruvate, we can see that the sigmoid approach is actually the most susceptible to an error in this T1 assumption. They are all kind of comparable in this T1 of lactate. We have probably most error with our sigmoid-based approach with T2 of pyruvate, and they're all kind of uniform with T2 of lactate. And that's kind of intuitively makes sense because for all three of these approaches, they are using a SSFP-based approach of the lactate. So you would expect a similar error tolerance or susceptibility based on errors in T1 or T2 of lactate. Whereas with the sigmoid-based variable flip angle approach, we would probably expect to be most susceptible to errors in T1 or T2 of pyruvate. Correspondingly, if we look at other variables that may affect our signal, the bolus characteristics after injection of our substrate do also heavily, or not heavily, but most uh, uh, affect our new approach. So based on how many seconds before the expected bolus arrival time, if there's an error in that assumption, we can expect some error in our KPL quantification, as well as the bolus duration time related to injection and arterial delivery. And then B1 scale. So interestingly, for whatever reason, with the variable flip angle approach, the B1 sensitivity, if there is a global mismatch in B1 power, we seem to be least affected. And similar for B0, um, with a BSSFP-based approach, one would assume that we would have some susceptibility of a B0 error, and that turns out to be not as big of a concern. We even for negative 15 to 15 hertz, we don't see too much error in our KPL estimation. This work was validated in rat kidney on still our clinical systems, but using a preclinical setup. And this is work done again by Anna Bennett, comparing our sigmoid-based approach with the hybrid ESSFP-based approach on the bottom here. These are the dynamic time point images. And the signal evolutions on right here. And if we look at a voxel-wise comparison, we see a nice intermethod agreement between the two. So from an implementation perspective and from are we actually measuring something real here, I'm pretty happy with these results. So we've moved on and have now adopted this for volunteer brain experiments, and I'm very excited to show these very recent results. We have now done 3 volunteer experiments in brain. So this is at a 7.5 in plane resolution, 15 millimeter slice thickness, but still using a true 3D approach with the sigmoid-based flip angle design. And the left is the proton reference flare image. The second image here is the matched KPL map. This third image here is the M0 pyruvate, which is the proxy here for the area under curve of pyruvate. And this pyruvate to lactate flux image here is the proxy for the area under curve lactate image. So these are from the approximate same slice as our reference image here. And this is without any denoising or smoothing or thresholding or anything. This is just the direct KPL maps and M0 and flux maps derived from matching. So just from a holistic perspective, we can see a nice cortical gray matter versus the deeper white matter differentiation. And you could, if you squint, hallucinate various structures like the thalami appear to have a slightly higher KPL compared to the basal ganglia. And I think this is a very, very promising first couple of volunteer experiments with this method. And like I said, we've done this on 3 volunteers so far. So this is the second volunteer. This one, for whatever reason, looks even better. We have, it almost looks like a low resolution version of the flare image, in my opinion, where we can see a very nice gray-white differentiation. This slice is a little bit higher up at the centrum semiovale, so it's predominantly white matter in the central component, but we can see kind of like the insula gray matter have the slightly higher KPL, similar to the rest of the cortex. And here's our third volunteer. Similar kind of trends. We have slightly higher thalami, lower KPL in the deep white, and higher in the cortex. And with this particular volunteer, we also got a 7.5 millimeter isotropic version of this. Clearly, it is a noisier result, but we can still kind of, if you squint, see the higher cortical values of KPL compared to the deeper white matter and slightly higher thalamic KPLs. So I think these are very, very promising, and we're going to continue to explore and see what kind of resolution is both reliable but also clinically useful for these. So overall, I think to summarize everything, we've demonstrated, at least theoretically, this improved measurement efficiency out of our time-limited hyperpolarized signal using this BSSP-based approach for KPL measurement. A lot of our simulation work was used to validate this. We also looked at the potential confounding effect of the other parameters within the signal model, specifically T2T1, pyruvate lactate, B0, B1. And then we did a decent validation experiment in rat kidney. And now we've also implemented it in pilot experiments in human brain. Our resolution that we did here is true 7.5 millimeter in plane, 15 millimeter through plane resolution, which is approximately fourfold higher than the lactate resolution for our most recent variable resolution approaches. And moving forward, this is very good, very promising in our normal volunteers, but of course we want to look at what various disease states, specifically glioma or other diseases, how sensitive we are to pathology with these kind of methods. And like I mentioned before, we've not applied or combined this with some of the other post-processing methods that we have been working on, specifically derivative low rank methods and denoising methods. And then I didn't really highlight this, but there is a kind of an overall magnitude difference in KPL matches we can see in our volunteer experiments already. And my suspicion at this point is that this is predominantly from different bolus characteristics between different experiments. So one thing I want to look at is if we can actually directly quantify this out of our signal model and our acquisition itself. And I mentioned before that T1 of pyruvate and lactate are variables that we are susceptible to. So there's always that question of, can we incorporate these in quantification and separate these out? And of course, I focused primarily on pyruvate to lactate, but the other metabolite systems, specifically bicarbonate, alanine, are definitely things on the agenda to look at to see if we can generate some nice maps out of as well. So thanks everyone for your attention.